So that gets us into some of the tests you were talking about before, like the OPKO 4K score as well as the Apifiny test. I think they're both really interesting tests. They're both very different. OPKO 4K score is actually a PSA-based test that measures what's called the inflammatory cascade. And the reason I like to describe it that way is because we really do believe that inflammation is the trigger for cancer. We're not talking about men who've had prostatitis or men who've had prostate infections. We're talking about a different type of inflammatory cascade that affects the way the cells will divide and multiply and trigger cancerous formation. And so this test, the OPKO 4K score, is actually able to help predict not only if you have a high-grade prostate cancer, but also what might develop it. And their data shows they can predict it for up to 20 years, which I think is really fascinating. And that's interesting. The Apifiny test is like all comers. It tells you basically, do you have prostate cancer or do you not, with a risk factor. It doesn't definitively tell you have it, it just gives you a risk factor. So it's kind of an interesting, I've actually ordered both tests on patients, and I've had where they've had a high Apifiny score but a low 4K. And I've told them, I said, what you probably have is a low grade prostate cancer that I don't want to diagnose. And that if you're comfortable with that, I'm comfortable with that, and we can follow you as if you have a low-grade one that we don't want to diagnose, and only if something should change, we'll then pull the trigger on a biopsy and make a change in our course.